Hi, and a warm welcome to another episode of Today's Parent. On Today's Parent, we are about connecting you with experts and providing you with information to make your parenting journey a bit more easier. I'm your host, Christine Casina. On today's show, we are talking about proper dental care for kids. You know, when it comes to dental care for kids, it's more than just brushing your kids' teeth or your kids brushing their own teeth. In studio today, we have Dr. Joyce Gitango, who's a dentist, who's going to share with us tips and information when it comes to matters dental care for our children. Dr.
Thank you.
Welcome to the show.
Thank you.
It's very
Thanks
nice to have you here. And it's very nice to have you here.
Yes, yes.
When it comes to dental care, let's take it from the very, very top. What is dental care and what does it entail? And why is it important for us to take care of our children's teeth?
Sure. So dental care is quite important, and we always say dental care starts at home. That's the most important place. So we always tell our parents, you have to make sure that your children brush your teeth twice a day. They have to floss too, which is not quite common, but we are trying to make it common now. And also nutrition is a big thing. You know what your children leave in the morning to go to school. What they carry in their bags. It's very important too, and it all encompasses with the whole dental care package.
Right.
So dental care starts at home. We enforce it, we motivate, and we make sure that our kids have healthy and strong teeth for a lifetime.
As dental practitioners, your work is to enforce. But then even before getting to enforcing, let's talk when babies are small, when kids are small, and their first teeth come out. When do we start? When do we need to start taking care of our baby's teeth? Do we do it at the point of baby teeth, or do we wait for them to come out and wait for the permanent teeth? Where do we start from?
So we usually recommend parents to bring the children in when their first teeth come in.
Okay.
So around 6 months, but we always just tell them by their first birthday, have them come in for their check. But it's not only just a checkup, but it's also education.
Okay.
Because we are in the business of preventing dental disease. So once they see their teeth coming in, they can bring them in, but at least by the first birthday, they should have visited their dentist.
As a parent, I'm trying to understand why at 1 year, at 6 months, 1 year, I need to come and see you because, we come from a place, most of us come from a place, I come to see a dentist when there is a problem. So how do you bust that culture where we come to see you when our teeth are decaying or we are in pain?
So for me, prevention is the biggest thing in my clinic.
Right.
We focus on prevention and primary dental care. Because obviously, if we do prevent situations happening, then it means that we're not going to be dealing with problems that the kids are going to come with later.
Right.
So usually in their first visit, we usually just slightly clean their teeth with some gentle brushes that we use in the clinic. But then we also now start talking, we have this avenue to talk to the parents about brushing techniques,
Okay.
And, when to start using fluoride toothpaste, because once they're young, we don't do fluoride toothpaste until they're about 2 years old. But mostly the technique, but also now some of the things that are happening now are things like, I don't know if you've heard of baby bottle caries. The nursing caries.
No, I haven't
so
heard of that.
It's dental decay that is caused by the parents putting their children to sleep with a bottle,
Right.
and their children come up with all this decay on their teeth even before they're 2 years old. So for us, it's an avenue to help stop certain behaviors before they become a problem.
Okay.
Because obviously, we know dentistry is also very expensive. So if we can avoid you paying high prices on dental care, it's a big thing for us.
Okay. So at 6 months, how do you brush a baby's teeth
So
at home? Because I've come to your place, you've shown me. I'm trying to imagine for a mom at home who's watching. How do you do that?
So usually I think it's very tough for children to be receptive to, having a toothbrush placed in their mouth.
Right.
But, we always have them play, have colorful little toothbrushes. We do have infant toothbrushes, there's toddler toothbrushes, and we have child toothbrushes.
Okay.
And all of them are specific for children at certain stages.
Okay.
But usually nice, they look at them, they're like toys. They can play around with them, so they become familiar with them. But once we always tell parents just to brush, even if it's with a towel, to make sure their teeth are clean.
So with a towel?
Even a towel, a cloth, just a little water, and just rub them a little bit, And then when they're a bit older and they have more teeth in their mouth, they can use like little infant brushes.
Okay.
They're very tiny little heads.
Are they sold in the supermarket?
Yes, they do have them, but usually we do stock them just just for convenience
Right.
for our parents. Then usually we also instruct how, because there's a technique. Most kids when they come, I mean, they're so little, so we have a technique which is called lap to lap, and we have the child lie on our laps while they look at the mother, and we are able to brush their teeth.
Okay.
So it's usually not a smiley affair. The kids will cry, but also we're starting them on a good slate with their teeth.
Okay. You mentioned something very important, the connection between dental care and nutrition.
Yes.
Are there things we can do better to, what we are feeding our children so they have better, better teeth?
Yes. So I always advise my parents to always look at the nutritional facts on what they're giving their children. Nowadays, there's like an overload of things on the shelf that are very high in sugar. And some of these things parents don't know. And sometimes we shock them. Some yogurts, some juices that, the parents give their children daily have enormous amount of sugars. For example, some packeted juice have almost 5 teaspoonfuls of sugar.
Wow.
I'm sure you wouldn't have 5 teaspoonfuls in your sugar, in your coffee or your tea. So that's what we're giving our children, and it's on a daily basis. I mean, of course, we have those, once in a while days out, we take them, we can indulge, of course, on moderation. But then now there's a lot of junk food that we are giving, the convenience foods, which are actually affecting their teeth, and we can really see it.
You've mentioned about what we are feeding our children. The one thing, for example, something you mentioned, yogurt. When I give yogurt, I have this satisfaction that I've given my child something healthy. So is there a way, even when it comes to something as basic as yogurt, do we then need to gravitate towards more natural yogurt or more natural juices?
Yes, with juices, I always say just juice at home. Just get some oranges, juice them, apples, just juice them. We can make juices at home now. We have now equipments to do that, right?
That is
But
true.
Even juices you can squeeze with your hands and give them. Give your child that. These other ones have additives of sugar on them, so we don't even know how much. Sometimes not all of them have the facts in them.
Yeah.
But yogurts also, we always recommend the natural yogurt. The natural yogurts are not. They're not as bad as parents really think they are. But if you feel like you need to sweeten them, put fruits in them. Put some raspberries, put some bananas, put something that your child loves. If they love mangoes, give them mangoes. So you can also give them yogurt, healthy, but also add something in it so you can, quote unquote, sweeten them.
Right.
Yes.
Those are very useful tips.
Yeah.
So Dr. Gitangu,
Yes.
why is dental care for kids important?
Well, first of all, we want to make sure that their teeth and their gums are healthy. But people always tell us that why do we need to do anything to kids' teeth? They're going to fall out anyway. These little teeth are important anchors in their little mouths because there are teeth that are going to be coming there. And we don't want to lose those baby teeth because once you lose baby teeth early, then that means the teeth that are coming in, they won't be coming in into their proper place.
Right.
But also, decay really affects children in school. They can't focus, they can't eat properly. And when you can't do that, you can't really thrive as a child. So it's very important not to ignore those things. We have a lot of parents who are like, oh, it's just decay. The teeth are going to fall out.
Yeah.
Why do anything? It does really affect these children. Maybe they're not able to communicate properly, but they do affect them. And when they do call and tell us, oh, the child cannot sleep at night, this child has been suffering for a long time.
Yeah.
And we've seen a lot of children improve in terms of how they're doing in school because they've gotten proper dental care. They've been able to resolve all their feelings. They've been done. But also we don't want to wait for the more expensive treatments, the baby root canals or the crowns, which are more expensive.
Yeah.
Why don't we start from the very beginning? Just coming in, we teach you how to brush. We do prevention things like doing fluoride treatments, and we do sealants, which protect the teeth from getting decay. So it's very, very important to take care of those little chomps.
Can you imagine the effect on their self-esteem? The one thing we
Exactly.
think, I hope we think about that as well.
Yes.
Because it can be a real issue.
Exactly.
Because you can't smile, and there are
Yes.
people over a long period of time because they used to smile in a particular way when their teeth are decayed.
Yes.
It just affects how they look at themselves and how they feel other people perceive them.
Exactly, and also decay does cause your mouth to smell. So you're running in school and your other kids are calling you stinky mouth. And you brush your teeth in the morning, but it's that decay that is sitting in there that's causing the stinky mouth.
that is definitely going to affect their self-esteem.
Yes, it will. Sure.
You mentioned about nutrition. The one thing that we don't think about as well is where our water comes from.
Yes.
So where I'm coming from with that is my son, the one issue that we have struggled with is fluorosis.
Yes.
When we're having this water in our home coming through, we never thought about where does this water come from.
Yes.
Because we look at it, it's clean water.
Yes.
And borehole water is a major cause of fluorosis.
Yes.
If you could just share some more on that.
Yeah, so let me explain what fluorosis is. Fluorosis is a dental condition that affects the tooth. And it does affect it intrinsically. It's more systemic. And it's caused by fluoride particles that are in water, but mostly in areas with boreholes.
Right.
There are certain areas in certain counties, you go to Naivasha, Nakuru, or even Mombasa, for a long time, people from those certain areas have been affected with fluorosis for so long.
Yeah.
But now even in Nairobi, we are starting to see a lot of people now, coming to a clinic and their children's teeth are stained. So it's very important when you move somewhere, when you're about to buy a property, find out where your water is coming from. And, you can measure your water. You can take a sample of it and take it to some of the people who look and see how much fluoride is in it. And you find out is this normal levels of fluoride so that before you move in, you are able to mitigate. And remember, it's not only drinking water. So most people will be like, oh, no, it's okay. We only drink from dispenser.
Water. Yeah, we can cook with the other one.
But it's even the water that you're cooking your food with will cause that systemic effect on your body, and then it'll cause fluorosis. So it's very important for us to know that beforehand, so we know, are we going to be able to filter out this water? Because also getting those filters can be quite expensive. So it's something
quite expensive.
So it's something that we have to let our parents know. But we always discuss that with our parents in the clinic too.
Dr. Gitangu, what are the common dental problems you see in children?
Well, the most common one obviously is dental decay. And actually, it's the most common chronic disease in children, affecting children worldwide, okay?
Right.
Decay is actually just a hole that's caused on the tooth by bacteria. It digs into the hole. And the thing is, they start small and they become bigger and bigger and bigger. And it's very important when obviously you should be coming to the dentist first to prevent the decay.
Yeah.
But if you see it, don't ignore it, because this tooth will get worse. Their pulps are very high, their teeth are very small, so they get decay really fast. So it's very important for us to treat it early. Doing a filling is very cheap. Doing a baby root canal and probably crowning the tooth is very expensive. And the worst thing that can happen is obviously removing a tooth, which might seem cheap to you right now. But remember that thing I told you, that when you lose your tooth early, it will bring bigger problems with the teeth coming in, misalignment, which means braces when they're older. So let us just attack the problem when we are at the first stages, instead of waiting for the problem to just resolve by itself, or waiting for the teeth to fall. Because one thing we have to know, these teeth are going to be there for a couple of years, at least maybe 12 to 13 years, until the big ones come in and take over that space.
So number one, tooth decay.
Yes.
Which other common
Number
problem
two
do
is
you
gum
see?
disease. Gum disease. Yes. Gum disease is where the bacteria affects the structures that surround the tooth.
Okay.
So that means the gum. So sometimes you have kids, obviously, the dexterity of brushing is really not the best, so they miss out on cleaning their teeth properly.
Okay.
And most people don't even know that the parents are supposed to be supervising their brushing until they're at least maybe 7 years old.
Right.
But one thing we see most parents not doing or encouraging their kids is flossing. So we have all these things that are accumulating in between their teeth and around the gums, and they cause this inflammatory process. That's what we call gingivitis, affecting the gums. And it gets worse to a point that, it starts causing their mouth to smell. And sometimes we get some parents who bring in their children because their mouth is smelling, but it's because they have they have gum disease.
What are the symptoms of gum disease?
So gum disease, number one, of course, we're going to have what we call the stinky mouth.
Right.
Yeah? So the mouth will smell. And obviously, you'll see a lot of bleeding in the gums, maybe when they brush.
Okay.
It's a lot of bleeding, but also a lot of staining. And that stain is the plaque, the soft thing that comes in the morning that is engulfing the teeth. So you will know that they have it. For sure.
Right.
Yes.
So we're going to take a short break. I know you didn't walk alone.
Yes.
We have Lucy Mwai, your
Yes.
dental hygienist, who's coming in studio.
Yes.
And she's going to tell the parents and show the parents how to properly brush our children's teeth.
Sure.
Thank you for being with us in this particular segment.
Yeah.
And when we come back from the break, we are going to have dental hygienist Lucy Mwai who will take us through how to brush our children's teeth. Don't go anywhere. Dr. Gitangu,
Yes.
we have a question that has come in from Mary in Nakuru. And her question is, she is expectant and she's wondering if the water she's drinking is going to, she lives in Nakuru.
Oh, wow.
An area I know is common with,
it's
fluoride
very high
issues,
fluoride
Nakuru,
levels.
Naivasha.
Yes.
So she's wondering if this is going to affect her unborn child.
Well, yes, it will affect the unborn child. So this is the thing about fluorosis. It affects the teeth at a certain stage when it's budding. And that is a time that the water, the high fluoride levels affect the children.
Right.
It's not like when the teeth are in the mouth and then it really does affect it. It's a specific time when the white part of the tooth is actually budding in the mouth. And sometimes we have, we do know that teeth, kids start developing teeth in utero, in their mommy's tummy. So yes, so if a mother who's pregnant is in an area with very high levels of fluoride, it's best for them to make sure that they are either they measure the water and make sure that it's the optimum levels, and if it's not, that they need to do whatever they need to do to filter the water, because it may affect the child, yes.
Thank you for sharing
It's
that.
a good question.
Dr. Gitangu, thank you so much.
Yes.
And just for your time and coming through to share all these tips,
Yes.
I know they're going to be very useful to the parents who are watching.
Right.
And for your team to also make time to come.
Yes.
We thank you and the team for coming through for this show.
We thank you for having us.
Thank you
we
very
really
much.
had fun.
Thank you very much.
Yes.
Lucy, welcome to the show.
Thank you.
On today's show, we are talking about proper dental care for kids. And earlier on, we had your colleague, Dr. Joyce Gitangu, who took us through, the importance of proper dental health care, especially for kids. And what's important for us to learn from you as a dental hygienist. First of all, what does a dental hygienist do?
Okay.
Before you take us through how to brush our children's teeth or how our kids can brush their teeth.
Okay. A dental hygienist is a dental professional, and what they do is mainly deal with the oral preventive care.
Right.
In terms of educating patients, creating their awareness about their oral health. You do clean the teeth, remove plaque, tartar, and do fissure sealants is a preventive measure for the teeth, and mainly cleaning and scaling the teeth, removing the tartar.
Okay.
Yeah.
So how many times are we supposed to brush our teeth? Children, adults, is it the same? Is it different?
Good question. It's the same. You're supposed to brush after every meal, but sometimes it's not possible depending on what you're doing during the day. So we say at least 2 times, morning and night.
Okay.
You should not go to bed without brushing your teeth. Very important.
So we shouldn't go to bed without brushing our teeth?
Yes, morning and night, 2 times.
Morning and night?
Yes.
Okay. I wanted to ask you, when it comes to brushing our teeth, at what point do we, or how are we supposed to, you've mentioned about flossing.
Yes.
We hear it being thrown here and there. I don't know if we do it. Should children do it? How is it done? Even before we get to just understanding the terms, we know what brushing is.
Yes.
Before we get to the routine of how it's done.
Yes.
What is flossing?
Flossing is basically a technique of removing food debris between the teeth.
Okay.
And on the gum lines, like where the teeth and both teeth meet at the contact area. And it's very, very important because it keeps the gums healthy. Some of the food stuff gets stuck between the teeth, and sometimes you're not able to remove that with a normal toothbrushing.
Okay.
So you'd have to go back and floss. So flossing again, also you want to do that at least once a day.
Once a day. So
Yes.
once a day we should floss.
Exactly.
At what point do we start using, for children, at what point do we start flossing our children's teeth?
Yeah, another
From what
good question. When the baby teeth meet, okay? Because at some point they have not met when they're growing in.
Okay.
When they meet, then and have a contact up and down.
Okay.
And the contact, then you start flossing. And I would say maybe from 2 years.
So from 2
Age.
years?
Yes.
So from 2 years we need to start flossing our children's teeth?
Exactly.
Right.
Yeah.
Let's get on to the brushing. How do you choose the right toothbrush?
First of all, you want to make sure you're using a soft Bristol toothbrush.
Right.
Okay. Then we also, in the market, we do have the age appropriate, depending on the age of the child. If it's in fact, we even have the infant toothbrush.
Okay.
Yeah. Where they're very soft, extra soft, and some of them we can actually use your finger to just kind of massage the gums and clean around the baby teeth. So we do go by the age appropriate.
Okay.
Okay. Then you want to make sure the bristles are soft. So when you're buying your toothbrush, this is one thing you want to check over here. Does it say soft?
Okay.
Because again, you don't want to buy a very hard bristled brush. Medium hard, that will wear off your enamel.
Okay.
The covering of the tooth,
So
the
you go
top
for
layer
soft.
of the tooth.
So
yes.
you go for soft.
Exactly.
Okay.
Yes.
So then let's go to brushing.
Yes. So we're going to brush today? Yes.
I see you've come with a set of very beautiful teeth.
Yes, the top teeth and the bottom teeth, but sometimes we separate them.
Okay.
So, yeah, so this is how you're supposed to brush your teeth. You want to use the right technique to brush the teeth, because you just don't want to go in and out, you know, like back and forth, because sometimes we end up wearing off the gum line.
Right.
Okay, and so the gum recedes and the teeth can become very sensitive. So it's very important the way you brush your teeth and the technique you use. So we recommend the circular motion, and how you want to do it is go all the way back to the last tooth.
Is
you
that
start behind there.
Is that how we should hold our brush?
No, I'm yet to show you that. So this is how you, maybe I'll better do it, you know, using myself as an example.
Okay.
So you want the toothbrush, the bristles facing kind of like 45 degrees angle up, facing on the gum line. Okay. And then you start from the very last tooth.
Okay.
Moving forward with a circular motion. Okay. And you give each tooth like 2 strokes as you move forward all the way to the back. And then the same thing in the back of the tooth.
Okay.
So ideally we're brushing outside here and behind the teeth. And then again we also want to brush the chewing surface.
Same circular motion?
No, with the chewing surface you just go back and forth.
Back and forth.
Yeah,
okay.
Exactly. So you're brushing 3 surfaces: the outer layer, behind the tooth, and the chewing surface of the teeth.
Right.
So you do that from the top teeth all the way to the back, behind, all the way to the back. Then you drop down to the bottom teeth here, right? So you want your toothbrush again facing down and touching the gum line.
Okay.
At an angle, 45 degrees. Same thing, circular motion all the way round, coming out to the end, and then behind the teeth. We call it the inner wall of the tooth, and then the chewing surface right there. Yes.
How long should it take when I'm brushing my teeth? Is there like a minimum time?
Yes.
A minimum time I should take brushing my teeth?
At least 2 minutes.
Minimum 2 minutes.
Yeah, if you're brushing for less than 2 minutes, then you're not doing a perfect job.
Okay.
Yeah.
The role of mouthwash.
Yes.
In in oral dental care, the full procedure.
Yes.
Is it important for us to use mouthwash? Can children use mouthwash?
Yes, and the mouthwash is important. It's good. Takes care of your gums, but it's not something you have to do every day. If you're actually brushing the 2 times, like we said, and flossing, because ideally you need, you can only remove plaque, because when you brush teeth, you're removing the plaque.
Right.
So you only do that mechanically.
Okay.
That is brushing, flossing, that's what removes the plaque. But the mouthwash is not going to replace those things.
Yeah.
Yes, you can use it, and sometimes you really don't have to use it.
Okay.
Yeah, we don't really need it.
Okay.
Yeah.
The top tips you can share with parents at home, because brushing teeth for these young ones can be a battle, and we don't want to set a precedence where they associate brushing teeth to be some sort of war.
Yeah.
How can parents make it fun at home?
Yeah, you can make it fun by making it like the family, time, and you all brush together, singing songs, like there's some songs we like singing in the clinic when you're cleaning the teeth. Brush, 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 brush your teeth, and you do it together.
Okay.
And and also parents assisting kids to brush their teeth.
Okay.
Because you should not leave them to brush by themselves until they are around 7 and 8, between 7 and 8 years.
All
So
right.
under 7 years, you want to assist. You want to go behind them and make sure they're brushing correctly, and
Right.
you get to the areas they won't be able to get.
That's
Yes.
a very important tip you've shared.
Exactly.
Thank you for that.
Yeah, between 7 and 8 years, then
Okay.
you can leave them to do it by themselves.
All right.
Yes.
Thank you so much for coming to share these tips. It's been wonderful having you
Yes.
and the entire team.
Thank you.
Thank you, Lucy.
Thank you for having me.
And with that, we come to the end of today's episode. In today's episode, we were talking about proper dental care for kids. And Dr. Gitango has been here with her team to share the tips of what we can do at home. Number one, to make this something that we do that is routine, especially going to see the dentist. It should not be something that we do when our kids have toothache and any other kind of dental problems. It needs to be something that is routine. And once a year, make sure that you go and see your dentist. And Lucy has been here as well to share how we need to brush our children's teeth 7 years and below, see how you can supervise and see how you can help them. I have been your host, Christine Casina. We've been here at Little Cribs, the home of exciting, durable, and fun kids furniture. If you're looking for parenting resources, go to www.supermamas.co.ke. See you next time.